It's helpful in the MEQ not to write past psychiatric history as a domain, because remember, what you're trying to do is to think about the points in past psychiatric history and use them in justifying the diagnosis. So for example, I will write a differential diagnosis of bipolar depression, and then in that I would put something like past history of hypomania, or identify if patient has been on mood stabilizers. If I want to put non-compliance with medication, then in the past history I might think previous non-compliance with medication, previously been on depot medication. So you can see I'm using some of the prompts in the past psychiatric history to justify my diagnosis. But if you just write past psychiatric history and points there, it's generic. The examiner doesn't know how you're linking that to the particular diagnosis. So these are just for prompts. Please do not write it in this format. It's too generic. Say for example, the last point there, psychology, referrals and usefulness. I might, if I'm thinking about personality dysfunction, I might say previously seen several psychologists with disengagement after a few sessions. That may be indicative of personality dysfunction. So you can see I'm just using that prompt to point out ECT to indicate the severity of depression. Past medical history. So if you look at diabetes, high blood pressure, I know it's vascular depression. I will write that down under vascular depression related to severe treatment resistance. I would write past history or history of diabetes and hypertension. Head injury and epilepsy. If someone is there with schizophrenia, for example, and I'm thinking there's seizure type activity, I might write head injury and epilepsy in brackets composite or complex neuropsychiatric hypothesis. So to justify the diagnosis. So the gist of this slide is that a medical evaluation is really important because, the authors of this particular paper reviewed 21 studies across a period of 45 years and found that at least 1 out of 3 patients produced symptoms, the physical illnesses produced symptoms showing direct relation to the psychopathology of the patient. And half of patients, 50.1%, suffered from significant physical illnesses. Of these, 58.2% were previously undiagnosed. So it's important. And this is a quick checklist for you to go through a medical evaluation. So you can see vascular, neurodegenerative, trauma, inflammatory, infectious, metabolic, endocrine, immune deficiency disorders, inherited. It's very, very important not to be generic. So if I'm thinking about a 72-year-old male with depression, yes, I'll add vascular, I'll add neurodegenerative, such as history of Parkinson's disease, for example. I might skip trauma, I might skip inflammatory, infectious, but metabolic, endocrine, I might put presence of diabetes, I might put thyroid dysfunction, deficiency disorders, vitamin B12, folate. So I'm going to be very, very relevant here and not be generic and write all of these. So please be mindful. Whilst if someone is a young female with psychosis, vascular is less likely to come in, but I'm more likely to put inflammatory or infectious there, immune mediated, endocrine factors higher up in this particular picture, along with epilepsy, for example, and trauma. So do be relevant when you're writing these particular points as justification. This is a checklist for you.